So as an industry, we've done tremendous work and made a ton of progress in enabling the sharing of health information to support treatment. But what we haven't seen is participation by other players that have a need and interest in accessing and sharing information, such as health plans and public health and providers really across the continuum and for a multitude of purposes beyond treatment. And so by having the government really lead in that, and establishing or supporting a trusted exchange framework and common agreement was seen, I believe, to be very much level setting and creating a piece of critical infrastructure for the nation that we haven't really been able to realize fully to date. So the great thing about Cures and ONC was realizing that this is a real operational activity and that they had the opportunity to work with a private sector organization, that they would work with an official capacity as a recognized coordinating entity in the RCE. And Sequoia was selected to serve that role in August of 2019, which you can imagine was a tremendous honor. What that means is that we operate with ONC under a cooperative agreement, which is a kind of grant, and the nature of that allows us to work as more of an integrated team. So we were brought on the inside of a governmental process and had the ability to work with ONC hand in hand on the terms that QHINs would be subject to, must comply with, what implementation guidance specifications and standards would have to be supported, requiring that at a minimum the exchange of US CDI, having very clearly articulated expectations on for what purposes information must be exchanged and where you have to respond. The idea here is that having a government endorsed approach carries a lot of weight. And even though it isn't mandated per se, but having these policies and this approach vetted by government has a lot of value to it.